Okay, so hello everyone. Thank you for coming to our American Congress of Rehabilitation Medicine's Complementary and Integrative Rehabilitation Medicine Networking Group. This is our Hot Topics series of webinars, and you can see the archive of all the past ones and this one as well on our YouTube channel. We're grateful to have you here, and in just a little bit, we'll be doing an introduction to our speaker, but my name is Matt Erb. I'm co-chair of CRM's webinars series, and I'm a physiotherapist. I'm located in Tucson, Arizona currently. And my co-chair, Dr. Pei-Shan Wen, who's an occupational therapy researcher and professor at Georgia State, is usually here, but was unable to attend today. So just acknowledging her presence and service to our group. Our speaker today is going to be Cheryl Van Demark, and the topic of discussion is around the role of manual therapies within integrative rehabilitation practice. And we'll have a full introduction for Cheryl in just a moment. Just a few housekeeping items, advising that this meeting is recorded and keeping any lines muted so that we don't have any interruptions during the talk. And if you have questions as we go along, type them into the chat as we go, and we'll also open the floor for questions at the end and address as many as we can. Just an additional tip, you can resize your screen between the share screen of the slides and the speaker's video if you'd like. So with that, it's my pleasure to introduce our guest speaker today. Cheryl Van Demark is a physical therapist, a certified yoga therapist, and yoga teacher with a master's degree in physical education and exercise science. Cheryl has enjoyed over 40 years of helping people recognize the gifts of embodiment, awareness, and movement to cultivate well-being of body, mind, and spirit. Her present clinical work is co-creator and co-facilitator of a chronic pain self-care program at Dignity Health Yavapai Regional Medical Center, located in Prescott, Arizona, that integrates pain science education with foundational training in mindfulness and self-compassion. Cheryl has long championed integrative rehabilitation practice. She has co-authored on a 2023 physiotherapy journal, PT journal. It's the journal of the American Physical Therapy Association paper that's titled Guiding Principles for the Practice of Integrative Physical Therapy. Offers courses through MedBridge and contributed a chapter on today's topic, which is reframing manual therapy, to a textbook on integrative rehabilitation practice. Cheryl's also graced with being a mother, wife, gardener, lover of nature, and a faithful servant to her dogs. And so we look forward to your talk, Cheryl, and we'll now turn the presentation over to you.
Thank you, Matt, for that lovely introduction. I'm going to share my screen. And as Matt mentioned, I am faithful servant to a dog community, and I'm the only person here at home this morning. So it's very possible that we might have a little doggy voices in our presentation, but hopefully not. All right, so you may want to make a pad of paper and a pen available to yourself during our talk. We have a few times that we will be using that. So let's lead off with our slides here. So our objectives, right? We're going to actually do a few simple practices together today so that we can work on how we can create and then sustain a more solid therapeutic presence with the people we're working with. And you'll use that little pad of paper perhaps to jot down ideas that come across to you today about maybe some new ways that you can engage in manual therapy. not just for working with persistent pain, but just for being able to regulate your own nervous system as you're working and be able to better sense the person that you're working with. And then I hope that we can reflect on what we're learning with an open mind today and a spirit of curiosity, because there's a lot to manual therapy and therapeutic presence that is in the realm of what we cannot yet measure in current science. Okay, so to grab that pad of paper and perhaps consider why you are here today. You know, why are you attending this webinar? What do you hope to learn? And then I always explain as a yoga teacher that the intention we bring to whatever we are doing is different than maybe why we are there to do what we are doing. So what sort of attitude, state of mind, state of heart, you know, can you bring to this learning experience today that would support whatever goal it is that you're setting for yourself? And then a couple of very user-friendly ways that we can work on deepening our presence with each person that we are with is to briefly pause, and let's do this now. Just briefly pause and notice whatever sounds are in your environment. Tune in to what sound is most distant right now. And then tune in to what sound is most close, which could be just the sound of your own breath. And then go ahead and identify any place on your body that in this very moment you feel most aware of. These are very easy ways to put mind and body in the same place at the same time, which is prerequisite to learn anything. Okay, I always like to start with language whenever I get the chance to have a teaching learning experience. So look at some of these ways that touch is explained. And then maybe look at the differences here between the definition of touch in general versus the use of the term therapeutic in front of touch. And there's the concept of social touch, which is its own thing, right? It has different qualities, as you can see. And of course, all through our day, you know, we are likely having many moments of social touch that may or may not be conscious for us, you know, can be part of our body language. You know? Certainly, having gone through the pandemic times, we probably felt the lack of that social touch aspect in our psyches. And then the idea in the research around touch, it's described in these ways. Touch that is present for us in our sensory system for the purpose of being able to discriminate. Like, do I need to, you know, become attentive to this stimulus that is happening or not, right? And then an affective form of touch is, how am I interpreting, you know, the meaning of this touch experience? Then we have yet another language around touch, the idea of self-compassionate touch or soothing touch. And we'll do this later on in the webinar as an experiential activity, but it's intended to help us cultivate self-compassion. And those of you that read anything about compassion and self-compassion, may recognize that in order for us to offer compassionate care, our own relationship to compassion is a necessary one to have before we can extend compassion to anyone else. I'll try to stop putting my hand in front of my face, Matt. Okay, so what is self-compassion? That's good to know since we're talking about language. So the research-based definition of self-compassion involves that we recognize that suffering is present in ourself and others, or others. So suffering is afoot, and then that recognition is coupled with a heartfelt desire to do something to alleviate it. So compassion is a verb, right? So some key components of self-compassion is recognizing what it feels like within yourself when you might be suffering. And just for brief clarity, suffering is present whenever we resist what is as it is right now. So recognizing if suffering is present, acknowledging that all humans are likely at some point in their lives to experience suffering. So it's common to humanity. There's a mindfulness component of being able to notice what you are feeling and how those feelings or sensations are connecting with some sort of emotional tone. And then a very key piece is once you notice what you are feeling in regards to any suffering, allowing yourself to have that, allowing it to be present. Recognizing is one thing, not turning away from it is something else, right? So choosing to stay with, usually briefly, this recognition of suffering, oftentimes because it feels unpleasant, and then to be able to consider how to nurture yourself so as to relieve the suffering, maybe not in this very moment, but seeing it in a larger perspective, what can be done. Okay, so soothing touch is going to relate to developing the skills of self-compassion. Okay, then there's the whole realm, of being able to consider what we currently have difficulty measuring in the science, in our present science. So I'm just going to read this. So the biofield is a concept that refers to an organizing principle for the dynamic information flow that regulates biological function and homeostasis. Biofield interactions can organize spatio-temporal biological processes across hierarchical levels from the subatomic, atomic, molecular, cellular, organismic to the interpersonal and cosmic levels. As such, biofield interactions can influence a variety of biological pathways, including biochemical, neurological, and cellular processes related to electromagnetism, correlated quantum information flow, and perhaps other means for modulating activity and information across hierarchical levels of biology. It's quite a mouthful. Okay, so we're talking about a deep level of sensing that is present when we engage in our manual therapies. I'm also trained as a Reiki practitioner, and so I look into evolving research in that realm as related to manual therapies. Okay. It's something I do for myself every morning, and for my doggy community here when someone needs it. So there is currently no scientific agreement, as you see at the bottom of the slide, on the notion of biofields, but it is an emerging area of inquiry. Okay. At a couple points in this presentation, I'm going to use this tool. This is a tool that I use in our chronic pain program. I'm going to ask you to at least think, if not note, at this moment so far in this language around touch. Has anything surprised you, annoyed you, left you feeling lost? Is there something that you heard that really applies to what you do? And is there anything you disagreed with? So it's a very useful acronym for adult learning. Okay, so let us now do a experiential activity, a brief body scan. And we're going to make use of our somatosensory cortex here, as is depicted in this lovely graphic. Okay, I happen to use this also in a chronic pain program. I open every class with doing this. As a yoga teacher for many years, I open every yoga practice with doing some sort of bringing attention to the body. So let's just do this now. Just get in a comfortable upright position. Your choice, eyes open or closed. Ideally, put your feet flat floor, heels down. Yeah. And let's just begin by bringing attention to one place at a time on the body, and it moves fairly quickly. So let's just begin with your right foot, like taking attendance. Feel your right foot, the footprint, the weight of your foot, the toes. And then do the same on your left foot. Find your left foot. Feel your footprint, the weight of your foot, the heel, the toes. From there, move up and just feel the way that your body is meeting the seat of the chair in this moment, particularly in the area between your two sits bones, how the flesh in that area is in contact with the seat of the chair. And from there, just go to your right hand, being aware of the existence of your right hand and maybe the position it's in without having to move it, look at it. And then do the same thing with the left hand. And from there, move up to your head. And notice in particular the facial expression that you feel you're wearing. You can always invite a gentle smile. And so now you've done a brief body scan from head to toe. Just shift into a quick assessment of your present moment sensory state. You can start anywhere. We already did hearing at the opening of this webinar. So shift to what taste might be present in your mouth, what fragrance might be present in the room. If your eyes are open, simply sharpen your focus for a bit on whatever your eyes might be taking in. If your eyes are closed, just appreciate the light show behind your closed eyelids. And then finish up with a sense of touch, like recognizing that the clothing you're wearing is touching your body and that this body is breathing in some fashion right now. So you might notice how the breathing body affects the touch of your clothing, like the contact points, right? Your body's expanding within your clothing each time you breathe in, and then receding a little bit with your out breath. Okay, so you can bring this to a close by thanking yourself for doing a body scan and a 5 sense check-in, enhancing your presence. And just go ahead and give yourself a quick review of, oh yeah, we're here, we're talking about touch. You know, what are some of the sensory pathways, right? Blow the dust off, let the moths fly out. Take this in. And then a recognition that we're also, when we're looking at the perception of sensation in particular, that we're talking about lots of additional brain structures that are involved in processing our sensation. And memory is a very big part of sensory processing, which we're going to touch on again later when we're talking about social touch and the way that a patient might be reacting to your touch based on their personal histories. So it's also, I think, really interesting to know that our sense of touch, like the neural structures around touch, are some of the first things to develop in utero, and that the skin, which is our largest organ, right, is very much involved at the very beginning in our formation, in the relationship of the developing embryo's sensory experience in the womb. And that there is, like the earliest exploration of touch seems to be involved with the fetus at this point being able to manipulate fingers and suck on their fingers. Ultrasounding is just a wonderful technology if you've never seen modern ultrasounds compared to the ones that I saw when my kids were born over 30 years ago. Really amazing. So there's also the recognition that the sensory experience that the fetus is having, it's a bidirectional experience. So the state of the mother's nervous system is influencing the state of the physiology of the fetus, as well as their, the mother's movements translating into the fetus experiencing those movements, as well as what's happening with heart rate and breath and whatnot. Pretty fascinating. Okay, so that really can lead us into the idea of touch and trauma, and how very important it is for us to have an appreciation of the whole human who is in front of us, and what their personal story might entail, particularly if we're going to be using hands-on, manual therapies. So this idea of the necessity of taking a social history. I cannot tell you how my heart hurts when I, if I'm covering for someone in the clinic and I've never met the patient, and I'm trying to, meet the person on paper, and there's nothing in the evaluative report about the social history. So it's very, very important that we have some conversations with our patients as the patient is able, willing, ready to, share their stories, right? So the idea that a history of trauma is very, very prevalent in our society that's a reality. There's a lot of post-traumatic stress disorder symptoms in our in ourselves in healthcare and in the people that we're serving. So, just looking at some of these symptoms that may be present in those that have survived physical, emotional, sexual, and other types of trauma is going to have a big bearing on how we may choose to create a manual therapy experience with the patient. And memory, as I mentioned, memory of touch experiences. Sometimes if you've been doing this long enough, you end up like discovering more about the person just by having started something manual, and it brings up a response from the patient that the patient wasn't expecting, and nor were you. Okay. So working with chronic pain as much as I do, that's pretty much my entire caseload now for the last decade or more. There's a lot of trauma history in people who have persistent pain. And it's very evident that in a community of people who've experienced trauma, especially those who also have chronic pain, that there's very different sensory processing going on. There's different ways that they are, well, really processing the whole world, but that translates into movement and breath. Okay, they're often very activated in the nervous system in such a way that there's hypervigilance, high fear of movement, these sorts of things, indicating that they have a very active hypothalamic pituitary adrenal axis function, dysfunction actually happening. Okay. So having talked about all of that, let's just take a moment here and experience what soothing touch might be. Okay, there's a couple of classic soothing touch positions that have been researched in the self-compassion literature. Very simple one is just a placement of the hands over the heart, not to try to necessarily feel heartbeat, but just to rest the hands on the heart. You can try that position for a moment, or the idea of, just a tenderness of the hand on the face, or just placing your hand, if there's somewhere on your body that just feels really tight for you or really an uncomfortable place, the idea of just being able to rest, and we all do this intuitively, just rest the hand, giving some light pressure, over a place on your body that feels like it would like to have that stimulus. So once you choose a place, then just try to bring most of your attention to where your hand is resting and to the tactile sensation that your hand is having, as well as your body is having with your own hand. And you can invoke feelings of kindness to yourself in this moment, a sense of warm-heartedness and tenderness to yourself, offering a soothing touch. I also find it helpful to just see what it feels like to breathe right to wherever my hand has landed. Breath moves the body, so just breathe to the place that your hand has landed. And then you can bring this activity to a close. You can thank yourself for having engaged in an activity that may be new to you. And soothing touch is one of many forms of what we tend to call micro practice. So it's something I do regularly when I am witnessing, taking history with patient, particularly if there is a just difficult psycho-emotional factors that are being shared. You know, I will rest my own hands on places on my body as I'm in conversation with someone. I do it in meetings. So it's a very useful thing to be able to do, to use soothing touch for yourself. It's also a possible way to begin to work with someone on them doing self-care, in sensing their like what their body actually feels like in certain places, to help them enrich their own mind-body relationship. So it's very, very useful. So again, you can pause and ask yourself these questions. Have I heard anything surprising? Anything that kind of gets to me, annoys me a little bit? I don't know why she's saying this. I feel lost. Anything that maybe you think applies to your clinical setting that could be helpful for you. And then anything you disagree with. Okay, so now into the meat, into manual therapy. So this is straight from the Guide to Physical Therapist Practice. And go ahead and tolerate me reading this if you don't mind. Because I found it very interesting. So this is what it says manual therapy is. So it's the synergistic application of movement-oriented strategies, integrating exercise and manually applied mobilization and manipulation procedures delivered along a continuum of skilled passive and active movement that involves the application of mechanical and movement-oriented stimuli that produces a chain of slides blocking it. I'm thinking mechanical and neurophysiological responses, including decreases in pain and symptom modulation, increases in range of motion, modulation of inflammatory mediators, autonomic, neuromuscular, endocrine responses that are mediated by individual contextual factors. At least that last little bit is in there. So this is like the operating current. This is off the current website for the most recent version of the Guide to Physical Therapist Practice. So maybe you look at a few things that might seem a little interesting to you that are either missing or the way things are phrased in this. All right, and then of course there's always the list of you know, physical therapeutic things that we do that fall under this. So there's our list. And then there's the idea of the context of applying any of these manual therapies, or engaging with, preferred language for me, engaging with the patient in the use of manual therapies. And the first thing to recognize, that I'm sure any clinician recognizes, is that there's this idea of exchange with the patient. You establish either a coherence or a lack of coherence as soon as you enter the room with someone, right? So this is very much why it is, in my view, essential, you know, to have some form of contemplative practice as an integrative rehab professional, something that you do that allows you to fully be present with someone, to witness suffering if and when it's present, and then to regulate your own nervous system so that you are creating an environment that is conducive, you know, with whoever you're with. It's vital. And that person's that you are with, right, their nervous system is reading your nervous system all the time. In fact, one of the people I study with is Thomas Hubel, and he's fond of saying that, or reminding us that, in fact, we are hosting, that's the word he used, we're hosting the other person within our nervous system. Take that in for a second. So this idea of attunement or coherence or co-regulating with someone. This is foundational before we use touch. Yeah. Okay. So touch in the context of manual therapy, it is helping to form a very solid therapeutic alliance. It deepens what sort of communication we are engaged in with the people we're working with, particularly in the realm of empathy. Okay. So it's also looking at, that there's terms for this attunement and coherence and whatnot that I referenced before in terms of using language of biobehavioral synchrony, right? How we touch influences the therapeutic experience, okay? It's very important that our nonverbal behaviors match our tone of voice. Also, that is an aspect of manual therapy that sometimes I think we might forget. And I think any skilled manual therapist already does this, and that is when we use touch, you are sensing how that person that you're doing manual therapy with, how they are breathing. And we can drop in to try to get some coherence in our breathing to enhance a sense of trust and create some relaxation. Right? So these sorts of things factor into the touch experience that not only is the patient having, but you, the therapist, are having as well. So in the pain science world, this is a pretty big area. So how we are using manual therapy, not just to do something to the person's body with our hands, but really reframing the use of manual therapy to become a collaborative way of helping the patient discover things about how their body is aligned, how their body breathes, and how the body moves, and using touch to co-inform, if you will, how the person is holding themselves and moving themselves, and noticing their own tissue texture, tissue tone, tissue glide, these sorts of things, making it a curious experience of enriching the mind-body connection for the person, so that primarily we can help the person identify and dispel things that are feeding fear of movement, right? Or things that they help them to myth bust, if you will, things that they may believe are present in how their body is, or how their body moves, that are really damaged when maybe they are not. The person's perception of their own power, and how to generate that power and access that power, and these sorts of things, to be able to use manual therapy to enhance that, I think is really, really important. Okay, so with conventional Maitland-based sorts of manual therapies and massage techniques and whatnot, I like to pull through this idea here as well, not just from the standpoint of what do I, the manual therapist, sense about movement in this area when I'm doing a technique, but involving the patient in when you feel my hands rest here, you know, what are you aware of? What can you feel? You know, if I'm doing some sort of a passive movement, seeking the person's input. What does this feel like to you? Not just does it hurt, does it not hurt, but just give me some language, patient here. Let's share some language when we move this. What comes up for you? What's your experience? You know, oftentimes you will hear things from the patient about, you know, what they see in their mind's eye as happening in their spine, and they will describe this to you, and that is so helpful to know if a person sees, you know, mind's eye sees themselves as fragile, vulnerable, you know, full of gravel, or you know, stickiness, or whatever it is that their perceptual experience is of this tactile stimulus that we are giving, right? So it becomes a much enriched experience working with people this way. Okay, and again, it tends to enhance the sense of safety. Now, all of this is done in the context of explaining to the patient what we're going to do first, getting consent from the patient that they're willing to engage in this rather curious way of receiving some hands-on work, right? It's all with permission and curiosity and interest of the patient, especially if there's a trauma history involved. Yeah. Okay. So of course, anything we do, we are a living system. Anything and everything we do is processed on multiple levels in the body, right? So we're looking also at the effect that touch has on allostasis, right? Fancy word for how the system is going to adapt and change to whatever stimulus happens to be arising in the moment. Helping people, especially with self-touch, soothing touch, helping people sense what happens in the body physically, like what movements occur, what breath changes, what heart rate feels like, those sorts of things. What happens when we are under conditions of stress versus under conditions of sort of neutrality versus under conditions of relaxation, right? It really is very, very useful in working in these ways with sensing nervous system and learning how to self-regulate the nervous system, okay? Which is useful in all aspects of life. Okay. All right. So of course, when you say this is a living system and touch is an input, then systems respond on multiple levels to touching, including on emotional levels. Okay. So finding out from people as we're working with them, you know, the question like, what comes up for you, or what's your experience when, you know, you're being moved this way, or we're moving together, you know, in a guided movement situation in this way, what comes up for you includes what emotions come up for you. Okay. Very, very useful to start to establish emotional recognition in people, like, you know, when I feel these physical things, oh, I also happen to be feeling this particular emotional tone, and this is how my body emotes that emotional tone. It's critical for chronic conditions. So obviously, we also know that, you know, massage feels great for some of us, and it induces relaxation, is another important physiological effect. All right, what am I doing? I got about 10 minutes left. So these are the things that I found were absent in the language in the guide to physical therapist practice, at least. I know there's non-physical therapists watching this webinar. But this was language that was completely absent from manual therapy. And I hadn't looked at this in a while. So I found it interesting that none of this language showed up in describing manual therapy. Perhaps you can add to this list yourself. And let's just end here. There's some more information for you that we can provide through a PDF of these slides, but I'm going to end with just a wee bit of yogic view, and I'm going to ask you to take a look at your hands. You can really only look at one thing at a time, so pick a hand, and I'm going to just talk to you, listen, and you keep looking at your hand, taking in this possible different perspective, on the hand being more than the hand. Okay? In yogic medicine, just about every part of the body down to the cell is reflective of the whole, right? So the micro is reflective of the macro in the body and beyond. So if we just explore our hand at this moment, starting with the thumb. The thumb is considered to represent an element of fire. Okay, there's in Eastern medicine, there's 4 or 5 elements. So some of the language may not be the same in yogic language versus other Eastern practices, but we're going to use the yogic language. So the thumb represents the element of fire, and the element of fire in the body represents eyesight and the sense of sight and light, vision. Psycho-emotionally, vision is also represented in terms of your vision for yourself in your life. And fire relates to your sense of personal power, your sense of endurance, right? Your sense of commitment. These sorts of things are representative of fire. So the next time you are feeling your thumb or working with a thumb on someone, you might remember some of what I'm saying today about it may be more than the thumb. Okay. Index finger represents the element of air. We are, of course, breathing creatures. Air is connected to the sense of touch, meaning that we feel our breath, as we did at the beginning of class, right? We feel our breath changes how our clothes touch our body. We recognize that, wind is present when we see it move a tree limb or, a flower or something like that. So air and sense of touch has also to do with your life force, your vital essence, right? We can go without food, we can go without water. We cannot go very long without air. So it's intimately connected to your vitality, to your prana, okay? That which moves other systems in the body. Breath is vital to moving all of the organs in the body in a way that helps them stay healthy. So index finger, all that. Middle finger now, longest finger, a sense of spaciousness, right? We exist in space, right? Within every cell, there must be intracellular space and intercellular space. The idea of spaciousness in terms of how you organize your life, how you use your space, how you occupy space, your alignment, your posture, like your presence in space. Middle finger, space element is associated with the sense of hearing. 2 fingers to go. Ring finger is associated with, excuse me, ring finger is associated with the earth element. Okay. the idea that we have this body, and the body is of the earth, right? It's made of carbon, oxygen, nitrogen, hydrogen primarily. So we are the elements of the earth. So all that is has form in the body relates to this ring finger on this beautiful hand of yours. And this relates also to our sense of smell. And then lastly, water element, the fifth finger, relates to our sense of taste with the dry mouth. You know, you can't taste things. Water, such a precious resource. We're made largely of water ourselves, water in terms of psycho-emotionally, in terms of like flow in our lives, flow in our speech, flow in our state of mind, flow in our creativity, flow in terms of water having all of these different states that it can be in. Water can be still, water can be enormously powerful. Think of flash floods. So there's all sorts of different ways, right, that water is present in our human experience. Okay, so when we are using these wonderful instruments of ours, perhaps we are doing much more than just the description of what manual therapy is that was in these slides. So I'm going to encourage you, before you exit from this learning experience today, I'm going to encourage you to take a moment and ask yourselves what it is that you maybe now think you're doing when you're doing manual therapy, right? What more could it be than occurred to you before you just listened to this in the last 50 minutes or so? Okay. So, Matt, I assume you are still there. I'm going to do a stop share. Is that okay timing, or you want me to go a bit further?
Excellent timing, Cheryl.
Okay.
It's
All right.
outstanding content. Just really grateful for all that you brought forth here, and especially that framework of noticing all the different layers, including, does this evoke something in you? Which is a part of the inquiry that I think is sometimes lacking in that epistemic humility and other layers, cultural humility. So I really appreciate how you've represented that. We do have just a question or two to bring forth to try on. And so we'll start out with that. The first is, this was submitted. I was reading something recently about body memories, and that they can be evoked in touch-based therapies. It was talking about like not just massage, but even like when people are in yoga postures and stuff, that emotions and memories can come up. I'm wondering if you could say a little bit more about that or your experience with that.
That's an experience. Yes, I can. That's an experience that I have just about every time I'm working with manual therapy in the way that I've talked about it today with people, right? Of course, I do a lot of conventional manual therapy as well, post-operatively, just restoring movement, soft tissue mobilization, all of those things on the slide. I still do that. I haven't like thrown the baby out with bathwater. But to give you a very concrete example of what the person asking this question might be talking about, working with a patient recently who was having chronic pelvic pain and had years of cystitis, bladder, chronic bladder inflammation. As I was having her experiment first with hands on her lower abdomen, being able to see if she knew where in her body her bladder existed, and then if she could begin to imagine that she could send something soothing to the place of burning that she was associating with her diagnosis. In so doing, I started asking her about the quality of what she was experiencing, and like, what do you think is burning? It's a pretty good question. What do you think is burning? And her answer was, well, it's burning because my nerves are fighting. And I said, your nerves are fighting? That's an interesting response. Tell me more. And so she then had a memory of being a little kid and being on a car trip with brothers. She was the only female in a family of boys. And she really had to go to the bathroom. And her father would not stop the car to allow her to go to the bathroom. And so, it was a very big memory for her. She was like, I forgot about that. I forgot how much in my family I was shamed when I had to go to the bathroom. She was the littlest child in this, experience. So that's a pretty concrete example, right? And it actually gave her a lot of insight about, as a, now 70, I believe, year old person, how she still will deny herself the timing that she needs to empty her bladder to this day, right? And of course, this is going to be very relevant to recurrent cystitis, not to mention to all of the muscular holding that goes on in our bodies, right? When we are trying to retain when we have that urge to urinate, right? So yes, there are many memories that come up when we are doing manual work with people or having people begin to really explore their own internal experience of the movements that happen all the time in the different rhythms of our own body, right? Sort of like our interior manual therapy, self-generated.
Well, it's a powerful experience and very representative of this reality that things, come up in association to what's going on in the body. And most of us don't think that way. It's very reductionistic, and, what happened there now or is happening there now is the only point of focus. So
right.
second question is one that I actually echo myself, partly because I read a book recently by professor of physiotherapy in New Zealand about current trends, like sociological or critical theory trends. And he was commenting on this move to in, at least in the physiotherapy profession, but I see it in rehab in general. And I think the pendulum is shifting back now, fortunately, but there was this tendency to discourage any passive therapies. It all had to be active. It all had to be empowered. I'm wondering if you could say just a little bit more about your thoughts on that topic, and where the value lies in these more, passive type approaches in therapy.
Yeah, I have a lot of opinions on that one. In fact, I was listening to that author on YouTube right before I was giving this presentation this morning, in case this came up. So I've been a PT for 41 years. A solid half of my career, I was in a position of being a clinician who also got to participate in the training of physical therapists in the clinical arts, back when we used that word, the clinical arts of the PT school. Yeah. Okay. And so I did that for a long time. Then I was away from it for a long time. Then I went back to it, and I was so distressed to discover how the students that I was working with, this was probably 10 years ago at this point, they did not know what to do with their hands. right? They absolutely did not know what to do with their hands. And of course, you know, the internship cycle is a lot of where we develop psychomotor skills, but um, just the orientation or the perspective that, you know, anything and everything they did had to be let's you know, we needed to use a machine, or we needed to you know, exercise, right, and we needed to use an exercise device, right? We could not like use this right as the device, or to be able to give um, proprioceptive cues in ways that, you know, old school people like me were trained, that was just essential. If you were doing therapeutic exercise, you weren't doing it like this with a clipboard, you know, or a timer. You were engaging with the person in their discovery of how exercise can be therapeutic. So yeah, I think that we made a hard turn away from that in the profession, at our own peril. Uh, I'm part of a physical therapy group now at Yavapai Regional Medical Center, and we 2 years in a row now got a clinical excellence award, our department, and specifically we're part of a nationwide group of hospitals, and we were in the top 1 or 2%, I think, for patient feedback in the experience. And you know, it boils down to this therapeutic alliance. We have time with our patients, we form a relationship with our patients, and we're putting our hands on our patients. And you know, people are asking us now all over the organization, you know, what's your secret sauce? Literally, like that's the question. And um, we're giving them feedback, and the secret sauce is what I just said. Like, we are in relation, we're hearing about their lives, we're, you know, working with these people, not doing to these people. And I'm not sure that that is as specific as you wanted me to get
No,
on
it
that.
absolutely is. And I'll summarize that it's about meeting fundamental human needs, and you're meeting
Mhm,
synergistic way through these different ingredients,
mhm.
needs that aren't otherwise getting met in the healthcare environment, and sometimes not in other areas of their life either. So it's of deep
Right.
value. So
Yeah.
we are at time, so I really appreciate your time and
Mhm.
that you took to put this together and to present this. Um, for those watching this, please like and share the video. Please look at some of our other hot topics talks, because you'll find a depth and a richness that's deeply needed within rehabilitation, the transformation of rehabilitation, and the evolution of it. So thank you again for showing up. Thank you again, Cheryl, for your talk, and we'll see you next time.